So we had a poster from a investigator-initiated trial that was looking at carboplatin, Nab-paclitaxel, and Pembrolizumab. This was a phase I/II clinical trial that started about 8-10 years ago, and it was really evaluating the safety and efficacy of a combination of Pembro with chemotherapy, specifically using Nab-paclitaxel. Our hypothesis at the time of designing this trial was that a lot of the platinum doublet chemotherapy choices we use require dexamethasone pre-medications, before, during, and after, that immunotherapy infusion. And we felt that pairing this with Nab-paclitaxel, which doesn't require steroids, perhaps could have an advantage over some of the other combinations. Turns out, our progression-free survival, overall survival numbers were about on par with other trials, perhaps a little bit lower than our original expectations with the median PFS of 5.6 months. But as we looked at the long-term outcomes from this trial, and that was the point of this poster, we see that the 4-year, 3-year, 4-year overall survival numbers were about on par with what we've seen from other trials like KEYNOTE-407 or CheckMate 9LA, for example, even though this was a small single-arm phase II study. One of the other things we wanted to highlight in this poster was outcomes by race, something that we haven't been able to look at in other phase III chemoimmunotherapy combination trials. Our trial, although small, enrolled 13% African Americans. This was numerically only 6 patients out of the 46 that were enrolled. But it did give us an opportunity to look at the outcomes in this patient population, which seemed to be on par, if not numerically higher, in terms of overall survival compared to the rest of the total patient population enrolled in the trial overall. So I think an opportunity to look at this, small numbers, but I think emphasizes the point that we really need to make an effort to accrue minorities in clinical trials and understand the outcomes in this patient population. We attempted to do that with this study in small numbers.